Hello, everybody. It's Alane Friend out here in California. I'm a licensed marriage and family therapist, and I have the great pleasure of welcoming my dad, Dr. Joe Friend, onto the Alane and Joe show. I just coined that term in our last video. I have invited Dr. Friend on to talk to us about some of the research and blogging he's been doing about COVID-19 and the pandemic. One of the things I love about you, Dad, and I said this in our last video, so forgive the repetition, but I really love the way you translate the information into terms that we can all understand. Why are you so good at that? What is that?
Well, probably started when I began general practice in 1970.
Mhm.
People don't understand medical term, and physicians sometimes do not know that they're talking over their people instead of to them. Not only that, I used to refer a lot of patients to specialists, and when they would come back, they had no idea what the specialist had told them.
I've had that experience.
Have the physician I referred to, I was in general practice in a fairly small town for 5 years. And I would have the surgeons call me, or the consultant, internist, cardiologist, call me the day they saw the patient and tell me, what did you tell the patient? So then I could interpret it. And I think from my days as a family physician, I learned to explain things to people.
Yeah, in English instead of medicine. It's actually a different language.
When you spend 7 to 15 hours a day talking with people in your profession, you kind of forget that not everybody knows the terminology we use because it's a different language just about.
I think one of the other issues is there are so many different opinions. It's hard to know what the truth is about the pandemic, the virus, the quarantine, the this, the that. So that's the other reason I really appreciate that we're offering this to people. So can I launch into my question?
Yes.
All right, here we go. Now that the country's opening up for phase 2, whatever that means, how does that affect people, especially the older population and those with chronic diseases? Do you think that the way it's being done is likely to stop the contagion?
Well, to answer that question, let me start out how I felt 6 weeks ago.
Yeah.
I was very much in favor of Trump closing down the country. And I was fairly critical of him not doing it. And I became a little more amenable to his thinking when he said that he was going to let the governors decide, because I do believe in states' rights, but that's a political thing. But when I thought about it, why would a town in Oklahoma with 2,000 people be subject to the same rules as New York that has 8 million? Or Oklahoma, the whole state of Oklahoma doesn't have 8 million. So I was kind of against it at first. But then when we started phase 1, 16, 17 days ago, I got to thinking about this. First of all, my wife and I have quarantined, strict quarantine for 8 weeks and 3 days and a couple hours.
Not that anybody's counting.
I'm in my 79th year, and I have several friends who are my age or about and older. I'm blessed with good health. They're not. They have cardiac disease, one's obesity, one's got lung disease, one's currently in treatment for chronic lymphoma. These people are going to be very apt to get very sick and possibly die. The huge majority of the deaths are in older people. Now that they've opened it up, I've kind of wrestled with it, and now I'm in favor of being wide open. And at first I thought, gosh, old people got to stay in quarantine longer. However, when they opened it up and let people start going into restaurants, I haven't gone into any, but I've driven by them. People are not wearing masks. And my previous blogs, people wear a mask to protect the other people, not themselves, primarily.
Let's
And
say that again. Wait, stop. Say that again. It's so important. People don't understand.
the reason to wear a mask is to protect your fellow man. And I've said in my previous posts or blogs, whatever they are, updates I call them, that I believe people before now, I believed that people had a social ethical, and moral obligation to wear their mask because they prevent other people from getting it. If you wear a mask, you prevent yourself from touching your face, less likely to. But now that they've opened up the country, people are not wearing masks. And with that being said, I think we're going to see an upsurge in cases. Look at 5 states. Texas, for example, it's just more and more cases of it. And I've did a 180. I think they should totally open up the country and let the people commingle and get it done. Now we're getting into some other subjects such as herd immunity. But the fact is we've done tremendous damage to our country. I think they made the right decisions with the information they had when they had it. But I think my blog on the end of April was we have to open up the country for the mental health of the people and the economic health of the country. So now we're doing it. But I think that those of us who are more at risk have to have the social responsibility to stay out of the fray. I'm not going to restaurants because I'm 79, my friends are. I think a lot of the millennials don't really relate to the fact that by wearing a mask, they could save a life. And that's true. But if those of us at risk stay out of the deal, they cannot wear a mask and they're going to get it. I think the studies out of Santa Clara County, Los Angeles County, New York, Miami, have shown that somewhere between 50 and 80 people have had the virus and didn't know it for every one who's clinically diagnosed. So those people are carrying the antibodies we had talked about in the previous podcast. Well, if you're carrying those antibodies, you probably have some degree of immunity. Let me relate this to things everybody knows about. As children, we were given the measles, mumps, and rubella vaccine. We've had polio vaccines, chicken pox now. Many of these vaccines provide immunity for life, and they do it because your body carries these antibodies. Now, if you've had the disease, and New York said 14% of their population carried the antibodies, and that's not counting the people who were sick. 14% of 350 million is 45, 50 million people carrying antibodies. I believe they could be donors of their serum and cure people. So has it been proven? Anecdotally, many people are testifying now how they got the antibodies and got better. And how long will the antibodies last? We don't know. Nobody knows the details of this disease. But
let me ask you a question. May I?
Yes, please.
We didn't have a chickenpox vaccine for a really long time. And most of us just got chickenpox and we got really good antibodies from it. So where my mind is going is, we're not going to have a vaccine, regardless of what the news says. It's going to take time to test vaccines and have vaccines. Here we are living in this world now with those millions of people most likely having COVID antibodies. So if we just go out in the world and get exposed to COVID, if we're relatively not living in poverty, if we're relatively healthy, if we have access to health care, many of us will get the virus. Most of us will survive it. Is it sort of like chickenpox? Like I took my kid to a chickenpox party to make sure he got chickenpox.
Well, not to diverge too much, chickenpox is a little different.
Okay, but it's still a virus and we still didn't have a vaccine.
You're right. And generally speaking, if you have the disease and you have the antibodies, you're protected many times for life. And not every virus stimulates antibodies that last for life. I've seen some reports that at the previous coronaviruses, they saw antibodies present in a year to 2 years. Well, I don't know if they tested them past that, but
right.
If you got your measles, mumps, rubella, and a booster in your teen years, you're probably protected for life. So we just don't know about this virus. But when a person has antibodies, they're not yet testing how many antibodies, what I would call the titer. And if you get a transfusion for it, or if you've had the disease, how strong are your antibodies? How effective are they at protecting other people? How long do they last? We don't know. No one knows these answers yet. My feeling is we have enough history throughout the last 100 years that people with antibodies do have protection, many times for a long time, lifetime for some. Now, nothing's 100%, but if people are walking out there, 45 million people in America carrying these antibodies, if I get COVID-19, I'm looking for someone with my blood type. It has to be the same blood type. And
Yeah, Dad, tell us if you get COVID-19, what you want to have happen. You were
well,
telling me this yesterday.
flying in the face of argument, and I'd be happy to engage anybody who wants to discuss it.
I'm sure some will.
First drug, well, everybody's heard of remdesivir, the antiviral drug. The big controversy, thanks to our president and Dr. Falsey with the National Institute of Allergies and Infections, was the hydroxychloroquine. And hydroxychloroquine, trade name's Plaquenil, if you're wondering what that is. It's been used millions of times to prevent malaria. Millions of people in the world take malaria. The side profile is known. Proper doses, proper watching, they don't have people dying and getting sick all the time. It can cause many symptoms. And if I got the disease early symptoms, I would want to be on Plaquenil, hydroxychloroquine. Chinese says it didn't work. They said remdesivir didn't work. Well, if you give it to someone who's about to die, it ain't going to work.
Too
But I
late,
would
right?
want hydroxychloroquine early in my treatment. However, you can't get it now in most places.
Mm.
If I started getting more symptoms, and usually the first symptom occurs, you get worse in about a week. If I started getting worse, I would want remdesivir, which, as I understand, has only been distributed to about 10 states as of last week.
Mm.
Remdesivir was originally formulated to treat Ebola. It didn't help, but the side effect profile was good, so we know it's not going to make too many people real sick.
I see.
So if that happened, I would be looking for the convalescent serum. That means someone who has the antibodies, either through the disease or in the future through vaccinations.
Oh, serum from them donating their blood. So
Yes.
I see.
Separate the blood into the blood cells and the liquid. The liquid has the antibodies in it and the proteins. And if they're your same blood type, that's what I would want. I don't know if I could get it, but I'd sure be fighting for it.
I'm glad to know. I'm sure everybody else is too. You know, you're making me think about the children and the Kawasaki's. I think I want to put that in another because it's a huge hot topic. So why don't we push pause and come back? Did I say anything else? Did I ask you anything else? Oh, what about stopping the contagion? I think we addressed that. It's not going to stop it. In fact, it's going to increase it, the fact that we're opening up, right? Is that what the point was?
I'm in favor of that. I think a minority of the population that's at risk should bite the bullet, stay home, get out in the sunshine, go fishing, but stay the heck out of restaurants and bars and common gatherings.
I mean, that's part of the problem with New York City is it's so densely populated. I have colleagues and clients living in Brooklyn and Manhattan that, you know, really feel like they can't even leave their apartment. And that might actually be true if they're an at-risk population because they can't get out.
There's other considerations about exposure in groups. Churches, choirs are bad. And there was a pretty good article by a research physician, I may have been a physiologist named Aaron Bromage, that gave some details about in a room without very much ventilation, a lot of people, the number of time you stay in there can affect it. So that's a whole nother subject.
Yeah. Okay. And I just want to say it's one of the things that religious institutions, my profession, family therapy, any kind of therapy, so many of us have learned how to offer our services online. It seems like it would be a good idea to keep doing that so that people who are at risk, who don't want to go out and get intense exposure, can still access it. And I think this is a time when people need that kind of support.
Let me make a very quick comment on the teledoc thing.
Oh,
I learned
yes.
my general practice in the 70s that when a patient came into my office and I walked in and greeted them, and the doctor's first thing is, what's bothering you? That's the chief complaint. I can tell you that somewhere between 90 and 100% of the time, not 100, the doctor knows your disease within a minute, and he knows what he's going to do for it. That's why some doctors, I don't consider them good doctors, can see 100 patients in a day. But with the symptoms you present with and 2 or 3 questions, probably 95% of the time, the doctor will know what you have and what he's going to do. And the good doctors will check you for other things while you're there.
So you're saying that having your initial exam on Zoom is probably plenty adequate.
Yes, unless you've got mitigating factors, comorbidities or risk factors, then you need to be talking to your doctor to see if you need it in person. May need
I
to
really
Zoom
think
on
our
it.
world is going to be permanently changed by this because we've learned so much about how we can use our electronic resources.
No question.
Yeah. Okay, we're signing off for now. We'll be right back. Thank you so much for joining us, Alane Freund and Dr. Joe Friend.
Have a good day.